Hey, before we continue on this week's episode, I got to talk about my brand new sponsor, the Social Work Brands podcast has a real sponsor, and I'm so excited. It's Herd Technologies Incorporated. And listen up, if you work in private practice, this is definitely for you. Herd is the financial back office for mental health professionals. On average, they save therapists more than 60 hours per year in financial record keeping and $5,000 in taxes. We're in tax season, folks, so pay attention. If you're in private practice, a social worker in private practice, they'll take care of all your accounting needs, including bookkeeping, taxes, and payroll. They'll support your business throughout the year to make sure that you get maximum deductions. Now, who wouldn't want maximum deductions on their tax return? I highly recommend them if you're looking to get help for your finances. Check out joinher.com for more information. This is a game changer. This is tax season here in America. So joinher.com for more information. Hello, social workers, mental health professionals, and change agents. Welcome to another episode of season 6 of the Social Work Ranch podcast. I'm your host, Bash Moreno. Saludos a todos. Greetings, everybody. Thank you for tuning in, tapping in wherever you are watching or listening to this podcast. Thank you, everybody, for continuing to rock and supporting the podcast. Gracias a todos por su apoyo. I really appreciate all the love and support. Make sure you continue to follow the podcast on all social media platforms, on Instagram at the Social Work Ranch Podcast. That is all one word. Follow the podcast on Twitter. Don't let Elon scare you. At Social Work Ranch, that's also one word. And don't let Zuckerberg scare you as much as he likes to hate online on the download. Uh, Hit the like button, type in the Social Work Ranch Podcast, hit the like button on Facebook, aka Meta, and of course hit that red subscribe button on YouTube. So again, this podcast is available on all audio platforms and also on YouTube. Like, share, rate the podcast if you're listening on the audio side. I really appreciate it. This episode is brought to you by Bass City Entertainment, your home for your online holistic self-care, featuring poetry and Zumba classes. The Zumba class is coming out. First one of 2023, Sunday, February the 19th, 12 p.m. Eastern, New York, Delaware time, East Coast time. Make sure you get your tickets at bassmoreno.com. We're going to have a lot of fun. Come out and support. It'll be on Zoom, so as soon as you pay for it, you'll get the Zoom info, and you log on, and I'll put you in in the Zoom room. So it'll be a lot of fun and good to get back out doing the Zumba classes. And also for those who haven't got my book, Trying Through Pain, How to Maximize Your Full Potential During Hard Times, is available on paperback and on Kindle. And later on this year, it'll be available on audio as well. So a lot of stuff going on. Our February is coming in Fast and Furious, and March is coming up Fast and Furious with all these wonderful events that's happening. And the power of social media is how I landed this talented social worker with Wilmaris Soto Ramos in Rhode Island. I finally hit another state. My first guest from in Rhode Island. How you doing?
Good, good. Thank you so much for having me.
No, awesome. I'm glad we can make this work. And again, the power of social media, if you use it correctly, is just make some connections. And hey, want to get on the podcast? Sure, let's talk about something. And we make it work. So here we are. So how are things going?
Good, busy day today, full of patience and but overall good.
Good. For those who don't know who you are, what you do, are wonderful, fascinating, challenging field of social work. Let people know who you are and what you do.
Yes. Hi, everyone. Thank you so much. And thank you again for having me. My name is Wilmaris, and I am a licensed independent clinical social worker. Full time, I work with the older population as a behavioral health specialist, which I always say it's a fancy term for therapist. um, and there I support my patients in primary care who are on Medicare. So a lot of low income population, patients who are have serious mental illness. And on my part-time work, I have my own private practice where I support women and couples who have experienced pregnancy loss, or any type of perinatal mood disorders. I also am the facilitator of a stillbirth support group that happens every third Tuesday of the month, and I also facilitate another group, which is terminations for medical reasons through the Postpartum International Organization. I'm a facilitator there, and I do that once the first Thursday of every month.
Busy lady.
Busy lady. I'm a mom to a 2-year-old, so
Oh wow. How do you balance all that and motherhood of a toddler? How do you do that?
it's a lot of village support. It takes a village, it really does. And it's interesting because I always tell my patients, you got to self-care, you got to self-care, and it's something that I too am trying to practice because I can't be a good therapist if I'm not taking care of myself.
No, absolutely. And part of my business motto is self-care is not a hashtag, is a way of life. And it's like, and it's hard because you do a lot of different things and it's like, it's just hard and you just have to be mindful of do something, whatever you enjoy, whatever you want to do, or even something you pick up a new skill you want to learn, if that's your way to, you know, to love yourself and enjoy yourself or whatever, like just do whatever works for you. So
Yeah.
um so you mentioned a lot working with uh I know they changed and I want to use the correct terminology, um uh, from older adults. I guess we use older adults now instead of just seniors. So, like I'm still learning.
I guess I use the term older adults.
Okay, we're gonna use older adults. So for somebody who might be a little sensitive and be like, say it correctly. uh, so yeah, working with the older adults. I worked in New York before I moved to Delaware. I would say about almost 2 full years, and I've had clients throughout different jobs I've had who are older adults, and they can be fun but definitely very very challenging, especially if they outlived everybody and it comes to like health needs being not being met because they physically can't anymore, and try to make sure that they're safe in the community. Otherwise, we might have to talk about a short-term placement that might lead to long-term rehab placement. So, what's your experience been like?
Oh my gosh. I mean, so interestingly enough, I've been working for Oak Street for 3 years now. I started off as their medical social worker. I got hired a month before the pandemic, so I too celebrated 3 years with Oak Street last Friday.
Awesome,
Um,
congrats.
Thank you. And I worked from home during the pandemic with older adults, and it was extremely hard. I mean, and now just seeing, like, going from seeing them from the pandemic and now being a therapist working with them and the aftermath, where a lot of them lost family members. A lot of them are still dealing with the repercussions of that COVID has had in their families. And we work with a population that's really tough, right? Because a lot of our patients, unfortunately, are low income. A lot of them are coming from different cultural backgrounds, and a lot of them either are facing, they have, it's multi-layered. Not only do they have a mental health need and challenges, but they're also chronic illnesses, right? They're
Hmm.
struggling with chronic health. We have a lot of patients who have COPD. We have a lot of patients who have chronic illnesses. One of my patients I was just on the phone with him today. He just got diagnosed with prostate cancer, and he's in his early
Mm.
so, and he doesn't have much family, so it's really tough. I think there's a lot of layers to this population, especially because they're coming in with years and years and years of trauma, especially for those who I'm the first therapist that some of my patients have ever seen in their whole life, and they have, again, like decades of trauma that they have not worked through, so that can be really challenging.
No, yeah, absolutely. And for those who've been listening to the podcast, and I shared right before we started recording of my losses of working with the elderly population due to COVID. And by the time I left that agency and moved to Delaware, it was like I counted 30 that passed away from COVID. That's
Wow.
at the time I left, and that's not including maybe like two or three that passed from the natural causes or just their ailments and stuff and being in the hospital. So
Wow.
so it was definitely a challenging time to say the least. And like you said, there's a lot of the cultural plays a big part of like not seeing a therapist and kind of like unpack childhood history,
Yeah.
things that they, because of culture and never like,
Mhm.
I just deal with it like and then like it kind of like something else triggers that initial trauma and is like trying to work through that and actually needing
Mhm.
to talk to somebody or they I had a client who just was crying all the time and just thought that was like normal just to cry
Wow.
every day, having crying spells. Like, no, and try to provide that
Mhm.
psychoeducation. Like,
Yeah.
it's not normal. Like, let's try to like unpack like what exactly is going on.
Mhm. That's huge. Yeah.
Like, what? So before we get into more of the clinical stuff, like, I don't. What exactly are you seeing in terms of like when I have people on, I like to ask like boots on the ground. Well, like, what are you seeing and stuff for Rhode Island in terms of the population you work at, with your private practice and your 9 to 5, like what exactly are the needs are, what is like the local government
Yeah.
doing to actually try to support, people day in, day out. What exactly are you seeing?
Yeah, I mean, we've definitely seen an increase in substance use in a lot of our patients, a lot of serious mental illness. So we're talking about schizophrenia, by uncontrolled bipolar disorder. Um, we have, unfortunately, a handful of patients who have just gone untreated for so long that they're really not here, right? Like, like they can't really have their reality is they're living in their own reality. And that's really hard because, we have to also work with them and meet them where they're at.
Mhm.
But when, they're not fully here, it's really hard to treat the patient because oftentimes they have very unrealistic goals of their care. um, so we see a lot of that with our population. Unfortunately, a lot of homelessness, chronic homelessness. And I think this is everywhere where the housing crisis is huge, right? Like a lot of my patients, unfortunately, have been displaced because of the high rent cost. Some of them in Rhode Island, we only have one big shelter in the Providence area and then some small shelters for specific populations like domestic violence, women's shelter, or people who are using substances. But the main shelter, unfortunately, it's a lot of our patients, and they've told me they rather like sleep under a bridge because it's just the conditions are not the best a lot of the
Mhm.
times. And you can't blame them, right? Like when they're humans too, they want to also live. They don't just want to go anywhere, even though they
Right.
need the support. But when people are stealing from them when they go to these places, or it triggers their use. A lot of my patients suffer from history of substance use, and they're trying to stay clean. But because they don't have housing, they can't stay clean, and it's really hard. So it just becomes like this revolving door,
Hmm.
and then little fires out every time because, again, there's also a shortage of therapists, and our program is intended to be more short term, but we know that's not the case. It's not going to happen. Like,
Right.
it's not possible now with the shortage of therapy, shortage of psychiatrists. Um, so there's a lot of challenges there. And for my private practice specifically, I'm getting a lot of, unfortunately, like a lot of sad cases around stillbirths, which babies that are born after 20 weeks, no longer alive, from Women and Infants, which is our major hospital here in Providence. Um, so a lot of sad cases there, and even sadder cases where they have to terminate a very wanted pregnancy due to genetic deformities or chromosomal abnormalities. So a lot of those cases, and there's not a lot of pregnancy loss support here either, which is one of the main reasons why I started my private practice.
Mm.
So yeah.
Wow. And I know from like studying like businesses, business, and having my own small business of my own, and learning like business formation. But I like how you saw a need and then you try to fill that need. You saw what was happening and you made it happen. Is that like why do you think that? Is it something with the population or something what do you see in that you know I know like people were still like, all right, I'm still gonna have the baby and still like doesn't matter. Like I'll do find like the resources, whether it be
Yeah.
whatever deformity or whatever. But what do you see like unfortunately
Yeah.
like the ending the termination of the pregnancy? Like what do you why is that? Is just cost or just culture or combination or like
Yeah.
what do you find it?
I think it's multi-layered. The reason why I really wanted to go into this area using my own background and my trauma-informed background, grief work background, it was because of my own experience. I had two pregnancy losses really late term, and my first pregnancy happened to be that my daughter was born with, well, she had some very serious chromosomal abnormalities where she wouldn't have lived past birth. And I was told by medical doctors through MRIs and a bunch of other testing that unfortunately she had a condition called arthrogryposis with fluid in the brain, where
Mm,
she was informing she wasn't growing properly, and I was advised to terminate the pregnancy or it could be dangerous for me and the baby. Um, and so unfortunately, we had to make a very, very difficult choice to terminate the pregnancy. I was able to hold my baby and be with her. But after that, I found myself in a very difficult state and trying to look for support and help. And I didn't really find any help here in Rhode Island. There wasn't many people who specialized in termination for medical reasons. Not a lot. I've never had anybody in my family experience it. It was really hard to talk about because it's kind of a taboo subject. Not many people
mm,
know about it. So it was also like I'm grieving and then also trying to sometimes having to explain what happened. And so sometimes I just defaulted to saying things like, I lost a baby because maybe not everybody would understand.
mm,
And I find my patients who have gone through that, they experience very similar sentiments where they don't know who to turn to. Some of them have never disclosed that they were even pregnant because of how much shame they feel
right.
as a result. And so I felt like this was such a need in our community that a lot of women are facing this. It can't be just me. And I have found that many people are in this have experienced this, and I've gotten a few referrals specifically for women who had to terminate a wanted pregnancy because of these type of abnormalities or these very, very difficult prognoses that they get. So trying to create a lot of awareness about this too, because again, not many people know about it.
Mhm.
Um, I was able to speak about this to the today. There's an article about me, about my pregnancy and the termination for medical reasons, as another form of creating awareness for other parents.
Wow. Well, I'm sorry you had to go through that, but and I'm proud of you for your bravery and wanting to like get back and help your community and help women who are experiencing that. And I kind of almost went through kind of a similar situation with my son. Like the doctors kept saying like, oh, like he might have like some sort of abnormality with like some chromosome and like to do a test and like that that needle that they put in the belly button that do that test. And my
Yep.
wife, my first wife was like, I'm not doing that test. Like just whatever happens, happens. And my son's perfectly healthy. I'm like, they did all that testing and and or not. We decided together not to do that the other test and like
Mm.
now he's a big no healthy 14-year-old now. So it's like
Uh,
sometimes the doctors just like
yeah.
what they don't know or they give an educated guess and kind
Mm.
of parents have to make that decision. So it's no, again, thank you for your bravery and again, no, I'm sorry for
Thank
that you had to
you.
go through that. So which kind of leads to everything that happened with Roe versus Wade and everything that we're going through now. I'm sure that kind of like added to extra trauma for you and clients that you
Absolutely.
help with that. Like,
Absolutely. Yep. I've had in the group that I run, unfortunately, some of them, they're all from different states, and some of them who were giving a really bad diagnoses for their pregnancies, whether it is that their baby would, would not survive outside of the womb. And for those who lived in states where um, that the Roe v. versus Wade is no longer applied, they had to travel. They had to find the funds to travel to a different state to terminate again a wanted pregnancy um, because continuing with the pregnancy would be a huge risk not only for the mother but for the baby, and more than likely, unfortunately, with the diagnoses that these women are given, the baby won't live past birth. And that's the most heartbreaking part of it all. That we're making really incredibly difficult decisions um, for the babies that we love. And we try to make the most educated decision, the best decisions we can out of love. But unfortunately, with these laws and policies that have been put in place, that have been taking these rights that have been taken from us, a lot of these women are now they're re-traumatized in
mm-hmm,
travel to a different state. And some of them who don't have the funds have to continue with the pregnancy, whether it is their baby has passed already and they have to continue with the pregnancy and be re traumatized again once they give birth to a stillborn. These are things that are not really considered or thought of when these policies are taken away from us, especially one that has been in stance for over 50 years.
mm-hmm.
So, yeah.
Yeah, it's is really unfortunately what's been happening in this country and kind of like you know it, it's like kind of like a loss for words of
Mhm.
what's been transparent here in the
Yeah.
country for several years now, and it's like it just see things that's happening in Florida day in day out, and see what happens in Texas, and then like kind of like Arizona that was happening, and we got a senator who was actually a social worker in Arizona who was like making dumb decisions out there, and it's like it's
Mhm.
uh just things are happening, and it's like if that's why voting is important. I mean, we seen it in other countries too, like women being oppressed has been going on for years, and when we've seen what's been happening in Iran, that the women are defending themselves, and actually the men know a lot of the men are supporting them. So it's
Mm.
like it's we've seen it throughout the world, and we kind of like you know enough is enough, and kind of like the fight, continues, and it's
Yeah,
fascinating what exactly is going on in the world. Beside all the bad, there's definitely like the goods coming out as well.
ab- absolutely. Yeah.
Uh, Now in terms of like I don't know anything like about like the government aspect of Rhode Island. I've been to Rhode Island once, and it was for like a craft fest. Like it was like 15 years ago, at
Yeah.
least maybe like 20 years ago. So no, besides that, like what like no, you mentioned about the population, you're seeing and there's like the drugs and the homelessness. I think the homelessness crisis is gonna continue, especially with all the COVID referendums that are ending slowly but surely. Here in Delaware, they seeing a lot of people going to lose their Medicaid
Mm,
because they just automatically renewed the Medicaid throughout the pandemic, and now people actually have to uh, kind of recertify and actually show proof
mm,
that they do qualify for Medicaid instead of you
mm,
make it $75,000 and you getting the Medicaid. So like
mm.
that's that's ending. So and there's already provisions in place here in Delaware to kind of like an extension of the Affordable Care Act for
Yeah.
people who don't qualify or they lost the Medicaid that to apply for. There's like a new version or like a branch, I would say,
Okay.
of ACA. At least that's happening here in Delaware. Are you hearing any things of that nature, especially you work in private practice or your 9 to 5 is?
I'm mainly seeing the housing referendums and the eviction referendums being lifted, and so that's definitely affecting a lot of my patients because a lot of my patients are experiencing homelessness. And even though like some of them are, I have a patient who has been homeless for the past 7 years, and homeless is she has not had her own apartment, her own place. She's been couch surfing, she's been living in the streets, she's
Mhm.
been now in the past 2 years she's been in a shelter program. So they basically bounced her from hotel to hotel, and she's on Section 8. And so there's just like so many layers to a lot of these things, especially with her case where her Section 8 voucher expired. And
Mhm.
because it expired, she almost didn't wasn't able to apply for housing again. And so they had to, the director of the program that she's a part of had to defend her and say, it's not her fault that her Section 8 expired, because it wasn't her fault. It was because were still not able to find her an apartment. Um, and every time they offered her an apartment, the landlord, they would see that she's on Section 8, and for whatever reason will turn her down afterwards. There's just, you really see, I think in our field, you really see how the system, the systemic racism,
Mhm.
um, how much it affects a lot of our population and the populations in need. I mean, even now with the Social Security increases, although it's like what 20, some of my patients have gotten $20 increases in their paychecks, some of them have gotten $100 increases, and then on top of that they're getting a letter, you got your increase, now we're gonna lower your food stamps. Okay, you got an increase, now we're increasing your rent. It's kind of, some of this stuff doesn't make any sense to me.
Yes.
You're giving our patients money, and these people are living in fixed incomes,
Mhm.
and you're increasing their benefits, which they're excited about. But then next thing you know, they're getting a letter that their food stamps are being taken away. And we know food is really expensive right now.
Yes.
Astronomically expensive. So to take that away, and then on top of that, to even increase rent, especially for subsidized housing. They're subsidized, they're living in subsidized housing for a reason. So some of it, it's frustrating. It's frustrating as a therapist, as a social worker in this field, to see some of this stuff happening, because we know who it affects the most.
No, absolutely. If you poor under certain under federal poverty level, if you're one, two, doesn't matter how your family size is like
Mhm,
it's just you get an increase in Social Security. They will find some way
mhm,
to take the money out. Some people are still paying their Medicare premiums on top of that too, even though most people got taken away. But there's people still out there paying a premium, and then now
mhm.
their food stamps are being cut, and it'll be like a drastic cut. Is not every dollar helps when you're like a fixed income like that, but is a drastic for $20 in you get
Yeah,
Social Security, that's like maybe like 40 to 60 at least for example that you get taken away in food stamps, and food is
yeah,
expensive. So it's like damn if you do, damn if you don't, and then that's not including transportation to go to appointments, or I have no money to go to my appointments. So it's like I had to pay rent and or
mhm,
whatever. So it's a trickle down effect, and I've been seeing this for years. This is like nothing new. This is not a 2020. This is not a COVID problem. Like this has been going on like in my 20 years in
yeah,
the field. I've seen this constantly. It's something that I talk about constantly, and remind people who are therapists. They might have a private practice and be like, "What's going on? Why you get cut or whatever?" And then not fully understand like the trickle down effect
yeah,
that does happen. So and it's
mhm,
unfortunate, but that's the good old USA for you.
yeah, yeah, yeah.
For my out of the country listeners, this is what happens here in America in social work. So if you don't know now you know. So it's and for anybody for these homeowners that not accepting Section 8, that's free money for you. Like that's guaranteed money every month. Like
Yeah,
now whether the client can pay their portion, whatever that portion is, and that's something different. But like at least you're getting something like every month, and for not accepting, there's like
mm,
a huge stigma for whatever reason
yeah,
in terms of Section 8
yeah,
that's been going on for years too. And
mhm,
even when there's like wait lists for Section 8, and it's like it's frozen, then it's like unfreezes, and so it's like I think that's something maybe the government needs to kind of like over. That's the next thing besides student loans. That's the next thing they need to overhaul is the
yeah,
Section 8 process
yeah. There's a
and
long list the government can get on.
but it's that's kind of like the way the land is in terms of the U.S. in terms of these housing these case management issues that
Yeah,
even like within our profession, like people like to like downplay like this the roles of social work case management
yeah,
roles that you can help clients in just day in day out, and the struggles are real. Like if you
yeah,
can't go refer you to therapy. Well, I don't have money to get to my appointment because I got to pay rent, or I got to buy
yeah,
milk or bread, and or like the eggs are like $9 in some
yeah,
states. So it's like it's a lot. It's a lot happening, and
mhm,
all at once, and then COVID didn't help any matters. So like I said, this is like been going on for
yeah,
decades. So
yeah.
um now talking about COVID, did like you mentioned like clients going through losses, like how was COVID like from your experience?
Oh my gosh, it was really tricky. I mean, it impacted a lot of our patients, unfortunately. And again, a lot of my patients had families that passed away. Some of our patients passed away. It was really tough too because so Oak Street, it started off in Chicago. And so there is Oak Street's in almost every state at this point. Um but we were asked to support some of the other states, which of course was really difficult because we could only do so much. I'm only licensed in Rhode Island. And so I couldn't do some of the things that they needed me to do in other states simply because I didn't have my license over there. And so sometimes we were asked to like assess for loneliness, and which of course, if we assessing older adults for loneliness, we may find that there is more going on than just them being lonely, right? There's
Yes.
under things like depression, there might be
Mm,
passive suicidal ideation, and there's no way for me to manage you when you're living down in Tennessee. And that is true story. I had to speak to somebody from Tennessee,
mm,
a patient from the Oak Street in Tennessee, And so some of these things came up for us, and I mean, even our patients locally, they were just really struggling. One of the things that, the really cool thing about Oak Street is all of our patients get transportation to all of our appointments. We have big old green vans that pick them up, drop them off. And if they don't, we go through their insurance. Sometimes insurance like Blue Cross Blue Shield will give them round trip, like I think it's 24 single rides and 12 round trips per year for specifically for specialist appointments. So our patients have that benefit where they get transportation to us, and then they get use that benefit for there. But one of the things that we started to do during the pandemic was, we did a meal. We started doing, passing out meals for patients who needed it, patients who weren't able to get to the grocery store. We started to partner with some of the local food pantries, and we had meal bags, and our drivers were delivering. I was delivering to my patients, on my own. Like I remember, I was like, we got to do something. This is when, in hard times, we find that community works faster than anything, right?
yes.
Like when we get together and people really put their brains together, and I think that's like the fastest and most powerful thing that we can do. So I went out, I bought some sandwiches, I started making sandwich bags, for any of my patients who I knew couldn't leave their house for whatever reason. There was some of my patients who had been getting radiation treatment or just really couldn't get exposed because of their chronic illnesses to the outdoors, and they were terrified.
Mm,
um so I would go and deliver food to their homes, um, and then donate some food to our clinics. That way we can make bags and we could deliver them to patients. We started a whole program where we started delivering meals to our patients, and that lasted for about a year. We were doing that for them. And that was just a bunch of us getting together, our region deciding that this was a need. Other regions hopped on board and started doing the same thing, just because we knew like the elderly population was one of the highest at risk for all of this. So
no, that's great, and this is why that the government need to cancel our student loans because
I know it.
we're
I know
risking our
it.
lives and we're doing all this stuff like during the
Seriously.
pandemic, and it's like nobody gives us credit. The
I
society
know.
doesn't give us credit, and it's like
Mhm.
even like an ASW, ASWB, and it's like or the
Mhm.
organizations that do the damn test, they
I
don't
know.
recognize us day in day out. So it's like
Yeah.
cancel our
Yeah.
damn loans.
Please.
The least you could do, we like risking our lives out here.
Yeah. I was out there pregnant doing those deliveries. Yep.
So it really was, and it still is a crazy time because COVID is still out there, and literally, if you follow the right doctors on Twitter, like up to like 3,000 people are still dying every week from
Oh,
COVID, and it's still out there. We got RSV, we got like
yeah.
monkeypox. What was a thing for a while that affected where I work at now. So um just regular common cold, got flu
Yeah.
season, just weather don't know how to act depending where
Nope.
you're at. So it's like hot one week and then it's like freezing the next week and got
Mhm.
snow. snow, rain, and it's like make up your mind what you want to
Yeah.
do. Don't know
Mhm.
how to don't know how to dress, and it's like
Yep.
so
Serious.
it's really the things that we do in the field. So it's like when we tell people that we're not in the field, what we're doing is like uh, the list goes on and on. Like the looks I get and like look like I had like 10 heads, and it's like
Yeah.
this is what I do. I go in the weather. It's like 100 degrees outside, and I'll go like it's like -9 and still
Yeah.
go door to door
Yeah. The
visits and
area.
or wherever like
Mhm.
so it comes with the territories, and that
Mhm.
this is what we do.
Yeah. Yeah.
So how was 2020? I know we were already like month 2 of 2023, but how was like 20 describe like 2022 for you? Like and
Mhm. I think the winter months are the toughest. I mean, I saw a big increase from end of August to December. There was a huge surge of patients just needing more support. Or my my current patients just really struggling. Like a lot of my patients, I do a lot of educating them. I start super early with the holiday season. I always start around summertime, starting to prep them, especially those who I know they have upcoming death anniversaries during the winter time, or if they live alone and have very little family or no family at all. I start sort of prepping them because it's not just seasonal affective disorder, but it's the grief that comes with the
mm,
holiday, dealing with that grief by yourself. A lot of the times my patients are grieving and they don't even understand that they're grieving.
mm,
They just keep coming to me and like, I feel tired. I feel
mm,
sad all the time. And they're like, and I'm like, I try to help them understand, you're grieving. Your parents aren't here anymore.
mm,
Your last friend just passed away. And that's a real story. One of
yeah,
my last friend passed away this past summer, and they were a group of 7, and that was the last one that was left, and she's now the last one. She's already lost her husband,
mm,
her son.
wow,
um she's pretty lonely,
mm,
and actually she just ended up at the hospital for a nervous breakdown. So that
mm,
all of that, I think, just uh a combination of all those things happened for a lot of my patients, and they don't realize it until they're already deep in. And
mm,
that's have to really start doing even more work. But I really try to prep them beforehand, to kind of get us thinking. When we start to notice these symptoms, let's really start engaging. So sometimes, thankfully, I have a lot of flexibility where if I'm seeing patients, whether it is on biweekly or sometimes I see them every 3 weeks, if I know that this time of year is really tough, I'm like, we're going to start seeing each other weekly because I want to make sure that we're catching on any symptoms if they're getting worse. Um, that way we don't go into, we avoid hospitalizations,
right,
because especially for my older folks who get panic attacks or have extreme anxiety, they'll end up at the hospital with chest pain.
mm,
And I'll talk to them and let's further assess. And I'm like, what was going on? And they'll tell me like they were feeling really anxious and their heart started to hurt. And I'm like, yeah, you were likely having a panic attack. So I do a lot of psychoeducation around
mm,
those things, and trying to prevent these hospitalizations from happening from our patients. So, but definitely around the winter time is always the toughest for a
mm.
lot of our patients. Sometimes the summer, but a lot of the times it tends to be the winter time.
Yeah, of course. We got like you mentioned Christmas, we got Thanksgiving,
Yeah.
and it's like and like you mentioned like that that one friend that passes away, or like you out like I mentioned earlier at the very beginning, like patients who literally outlived everybody, talking about siblings, their own kids, like their
Yeah.
husband or wife or whatever, and it's like they're the only ones left, and it's just you're
Hmm.
the therapist or social worker, case by whatever, like the professional, you're their main source of contact in order like to talk to them, and it's like that's it. That's all they have, and it's like, or if they lucky enough to have a home attendant that comes and helps them clean the house or whatever, like home attendant services. The home attendant is literally that one person that they have, and it's like that's it,
Yeah.
and that's a reality. That's what I
Mhm.
had to deal with, and working, and what I kind of like deal with now on a personal aspect, with you know, my dad and with his grief and the loss of
Yeah.
my mom and
Yeah.
his only brother, and it's like that's part of your
Wow.
grief, and like it's kind of hard to to provide that education. Like
Yeah.
you're well, like kind of like we're grieving like the same people, and we're like in different aspects of grieving, so it's like kind of like a fine line or where to cross, and it's like I don't want to wear my professional hat at home because I want to leave it
Yep.
out the door, but it's at the same time you see like you got to use your professional skills, and kind of like this is what you're going through, and it's like no, that's not it. It's like yes, it is, and it's like all right, just leave it as it is because we're
Yeah.
not getting anywhere. But you know exactly what it is, it is real. Is real, and these conversations need to continue to happen. We see them, and people are living longer. So thanks to
Yeah.
medical advances, and which even makes the situation of food stamps being cut and
Yeah.
increases even more
Yeah.
stupid because people living longer, they're gonna need these services, and we got
Absolutely.
people in the government always want to
Mm.
cut Medicaid and always cut Medicare and cut food stamps, and but people are living longer, so that doesn't make
Yeah.
sense.
Yeah. Absolutely.
Um, where like what so any goals for the rest of 2023 since we're like in the middle of February?
Yeah. No, I think just continuing to expand my work and my skill sets. Like I really love the work that I do. I really love working with my older population. I was a school social worker with middle schoolers, and bulk of my career has been working with youth. I did not think that I would enjoy working with older adults as much as I do. And of course, my private practice, it's just been incredibly rewarding for me. Like I know my patients, all of them are experts of their own experiences, and I do not take the work that I do with them for granted. I've learned a ton through working with my patients. I definitely look at life differently through working with my patients. I mean, how could you not when you're sitting here like you're talk about getting older. One of my patients, he's my oldest patient, he's 83. His brother's 95, still driving, and his other brother is 88. And and they're not going anywhere anytime soon.
Yeah.
They're healthy. I mean, so healthy. So it's I've learned a lot about just working with them, not only about mental health, right? And the stigmas. Um, they debunk these stigmas, right? Especially for the older population. I think too it's hard because it's not just them coming here with, a new diagnosis, right? A lot of them have had these diagnoses that they've had for decades. And some of my patients, I've had the privilege of being their first ever therapist and and being able to support them and help them. And for some, they've even told me, I've never had anyone explain my mental health the way that I've been able to because I really dive deep into symptoms and connecting, trauma from childhood to now because that doesn't go away just because you're 80 something years old.
Mhm.
You
That's true.
carry your stories no matter how old you are, your childhood, your past versions of yourselves are always with you. And helping my patients understand that and those aha moments and sessions have been incredibly rewarding for me. um and for those reasons, I don't I my work is not done, it's only beginning, and I'm excited. I'm really excited.
No, that what you said is so true. I mean, I used to do school social work too, and is I definitely would rather work with the older adults than doing school social work. That you just learn a lot, and especially from the medical side, and you learn all these just
Absolutely.
medical terminology, and you learn medical social work, and that's kind of helped me out. Where a couple jobs that I've had, so it's like it definitely it helps. It's always good to learn, and you learn all these systems, the Social Security and
Mhm.
the Medicare and how they go together. Like you can't have
Yeah.
people who turn 60, about to turn 65 and having them apply for Medicare and
Mhm.
they're getting ready to retire or they're still working or things of that nature and just the little things the day in the day out that
Yeah.
that they need or they just sometimes you just need just to listen and have
Yeah.
them just talk and that's it. Nothing was like nothing was accomplished that you were a ear for them to talk and
Absolutely.
vent and that's all sometimes that all that takes.
Yeah.
So
Yeah.
yes.
I think honestly, like I think sometimes sometimes I think people who think of the therapy profession may think, oh, you're this clinical person who knows it all and who's gonna tell me my diagnoses. And sometimes that's how my patients see me there. They'll ask me, what do you think? How do you see me? I'm like, well, how do you see yourself? You know, like
Right.
sometimes they think I'm gonna give them all these answers and like fix them, and I'm like, no, we're here to do the work together. Like the analogy I always use with them is, you're the driver, I'm the passenger, I'm your GPS here, and if I tell you I think we should take a right now, and you take a left, all right, then I'm gonna go with your left because you're deciding to do that. I'm here for guidance, but if you don't take my guidance, then I can't do much there right now. Um, so I think I think it's important to like when I'm in the room with my patients, I never act like I know it all or use fancy clinical terms. And if I do, it's when I'm explaining things like the nervous system and I really break it down for them so they can understand how it's working and how it's affecting their mental health. But otherwise, like they're the leaders in in their journey, and I'm really there as a guide. I give them the green light all the time to fire me if I'm not working for them, because I may not be a good fit for all of my 151 patients.
Mm,
They may need someone else, and that's okay. That's part of the work, right? And it's just, again, like you said, it's not always going to be these structured CBT sessions.
yeah.
They may just need to just vent. Maybe they
Mm,
just have a lot going on and they just need someone to listen because they're caretakers to great grandchildren or grandchildren, which is a lot of my population. Grandparents taking care of their grandbabies
mm,
and being parents again at 60, 70, to 18-year-olds. Like that is a lot. And sometimes
yeah.
they just vent.
No, absolutely. No, that is that is so real that it is it is a lot. And for the new social workers that listen or who are in school, it's okay if a client fires you. That means you doing something right. That doesn't mean you're not doing anything wrong. Like it's gonna happen. It's just
Yeah.
uh, uh, so it's just part of the deal. So just don't take it personal. You just keep going. You got a million other clients to see. One person
Yeah.
you might be at an agency or somewhere that they're gonna look at that one firing and blow it out of proportion. So the rest of the clients who like you and you get a good rapport, and so that might be a red flag. You may have to like leave that job if they want to blow it out of proportion. But you're gonna get fired. It's part of the
Yeah.
territory.
Yeah. I've gotten fired. I don't take At the beginning when I first started early on in my career, of course, especially working with kids. Kids are ruthless. They're honest. They tell you the truth.
Mhm.
you know, Here at my with older adults, sometimes they just ghost you, and
Mhm.
sometimes that's okay.
Yeah.
Like okay, they'll never come back. But some have told me, I'm not ready for therapy right now. Sometimes when they step in and we start really doing the work, sometimes when patients haven't tapped into that, they may not be ready, and that's okay. And again, I'm young. I'm younger than most of my patients.
Mm,
And so sometimes they may feel like maybe I haven't really run into this a lot, but some patients may feel like because I am younger, they may not be getting the services that they need.
mhm.
Which I don't take offense to it.
Right.
Think the most important thing is that they're getting the help somewhere. If it's not with me, I always tell them I will help you find somebody else, and that is totally fine.
Mhm. Hey, who's this young buck telling me what to do?
I know, I
Back
know. It's
off.
like I some of them come in and they'll, and especially those who are educated will come in and ask me, what are your credentials, what
Mhm.
did you study, you know, and it turns to be like sort of a session for me. I'm like, hold on, this is for you. But I'm very honest with them, and I tell them, if you don't feel, you can try it out. If you don't feel comfortable, that's
Mm.
okay.
Yeah. No, and all that I experienced all that as well. It just comes with the territory. It is what
Absolutely.
it is. But
Mhm.
where can people find you?
So I'm Wilmaris Ramos on Instagram. You can also look me up, Begin Again RI, on Instagram as well. I'm on Facebook, Wilmaris Ramos. Um, yeah, those are my social media. You could request me. Begin Again RI is probably the most that you could certainly request me there. That's also my private practice. But my regular Instagram also has that information too there.
All right. Also, I already told a couple of our outside of Rhode Island peeps. I got to go back up there even for a crab fest one of these days.
Yes, love that, especially summertime.
Yes, in the summer. That's where I went one time in the
Yeah,
summer. So,
yeah, absolutely.
pleasure having you on. We'll talk soon.
Thank you so much. Take care.